Let's look at an extremely important topic in obstetrics, which is HIV and pregnancy. Today, we'll be discussing the effects of HIV on pregnancy, especially in the prevention of HIV transmission from HIV pregnant women to their babies. So, mother to child transmission, that's the MTCT of HIV, occurs when infected mother passes the virus to her baby. This can occur during pregnancy, labor and delivery, or breastfeeding. So we'll be looking at the epidemiology. Over 90% of HIV infections in children under 15 years of age are due to mother to child transmission in the absence of intervention in HIV positive mothers. So 15 to 45% of infants will acquire infection. 25% of these will acquire infection during pregnancy. 10 to 20% will acquire infection during labor and delivery. 15% during breastfeeding. So there is a 90% chance that HIV infection will be passed from mother to infant if there is no medical intervention during pregnancy, delivery, or breastfeeding. So note that delayed institution of prevention of mother to child transmission will result into a higher risk of transmission of the virus to the baby. So the burden of mother to child transmission of HIV is higher in sub-Saharan Africa. So what are the risk factors for mother to child transmission? First, are risk factors during pregnancy. Here we have high maternal viral load. We have infections, e.g. malaria in pregnancy, sexually transmitted infections, malnutrition, hemorrhage, that is antepartum hemorrhage, which is excessive bleeding from the female genital tract 28 weeks during pregnancy, or bleeding before the onset of labor. So invasive procedures like amniocentesis, chorionic villus sampling, external cephalic version can also predispose the fetus to mother to child transmission. Next is mother to child transmission during labor and delivery. So these are the factors that will risk a child contacting HIV from the mother during labor and delivery, which include high maternal viral load, prolonged rupture of membranes, that's PROM, chorioamnionitis, prolonged labor, invasive procedures like fetal scalp blood sampling, instrumental delivery, episiotomy and genital laceration, first infant in multiple births, and fetal genetic characteristics. Next is risk factors during breastfeeding. So we have high maternal viral load, duration, early mixed feeding, breast fissures/infections, poor maternal nutrition, and oral disease in infants. So what are the elements of prevention of mother to child transmission? First is primary prevention. Next is prevention of unintended/unplanned pregnancies among women infected with HIV. Third is prevention of HIV transmission from infected women to their infants. Fourth is provision of treatment, care, and support for women infected with HIV, their infants, and their families. So, what is the primary prevention? Prevention of HIV infection among women of reproductive age group includes the ABCs communicated through health education. A is for abstinence, that's the best option. You prevent having sexual intercourse at all. B is for faithfulness to one uninfected partner. C is for condom use consistently and correctly. So it is not just the use of condom, you use it every time you have sex and correctly. So second is prevention of unintended or unplanned pregnancies among women infected with HIV. So access to counseling and referral for family planning. Safe, consistent and effective contraception. Integrate dual protection messages into family planning counseling services. Third is prevention of HIV transmission from infected women to their infants. So we basically have two interventions, which are core intervention and specific intervention. In the core intervention, HIV testing and counseling is imperative. Antiretroviral therapy, that's ART, and prophylaxis. ART is long-term use of antiretroviral drugs to treat maternal HIV/AIDS and prevent mother-to-child transmission. Antiretroviral prophylaxis is short-term use of ART drugs to reduce HIV transmission from mother to infant. So you do safer delivery practices, you do safer infant feeding practices. Combination intervention can reduce mother to child transmission rate to as low as 2% in the absence of breastfeeding. So next is specific interventions. Here you do antenatal management, such as you prevent, screen and treat tuberculosis and malaria. You prevent and treat infections, urinary tract infections. You treat recurrent vaginal candidiasis and prevent as well. You prevent unnecessary trauma during childbirth, which minimizes risk of postnatal hemorrhage. Use safe transfusion practices such as blood screened for HIV, hepatitis B and C viruses. So we'll move to elective cesarean section. You consider it when safe and feasible. Should be done before onset of labor or membrane rupture. So vaginal delivery should be started when antiretroviral prophylaxis or treatment has effectively reduced viral load and no other contraindications to vaginal delivery. So fourth is provision of treatment, care and support for women infected with HIV, their infants and their families. In the first stage, these women have already been infected with HIV as well as their infants. So here is how to treat and provide care as well as support for them and their families. So first of all, you do treatment of symptoms, you give palliative care, you give nutritional support, reproductive health care, and psychosocial and community support. Thanks for listening.